Hello, everyone. I'm here with Justin Chi, the Director of Clinical Technologies at Glidewell Laboratories. He's kind enough to join us today. I wanted him to show how great the software for Glidewell Mill is and how easy it is to actually incorporate same-day dentistry into your practice. Justin, thank you for joining us. Go ahead and introduce yourself. Give me a little bit of your background that you just told me. Very interesting.
Thanks, Bob. Thanks for having me. Again, as Bob mentioned, I am a dentist at Glidewell. I've practiced here the last 7 years. Graduated from USC 7 years ago. And prior to that, I was a dental technician, had my own lab out of my apartment in Dallas. So I did that for about 4 years. And I also was a CAD CAM trainer with D4D Technologies in Dallas. So I did that in conjunction with running a lab out of my apartment. So it was really through observing what CAD CAM technology, same-day dentistry did for dentists and their patients that really motivated me to want to pursue dentistry even further. So here I am getting to spend time with all of you because of the technology. It's been great.
That's awesome. And also, when you say you're a dentist here at Glidewell, I used to, just a quick story, I used to get these Glidewell material here in the Chicago area. And I was like, why are they sending me material from California? I always thought Glidewell was a, local lab like the ones that I use until I visited Glidewell, and you guys are basically two blocks city
For sure.
worth of buildings, and so you are a dentist for the employees there, correct?
That's correct. Yeah, it's myself and two others. There's Dr. Bender and Dr. Manolili, a prosthodontist, and we do treat the employees, and we do a little bit of everything here, and a lot of it is driven by projects and new materials and different techniques that the lab is working on to continue to make improvements to the lab and dentistry in general. And one of those is chairside CAD/CAM. So I do a lot of the testing with the in-office system.
So the clinic is not open to public, just for employees.
Just for employees, that's right.
Wow. And is it offered to them as an insurance? Do they pay, or is it minimal pay? How does that work?
It's all pro bono. So yeah, it's a great benefit for those that qualify. We unfortunately can't see everybody because we have a lot of different responsibilities, but for those that we do see, it's a great service for them, and they get to get a lot of quality dentistry, and we do use their cases for our educational purposes.
Wow, that's great. And also, when I visited Glidewell, it almost looks like you guys model your campus like a Google campus. You have restaurants. It's a very interesting thing. If anybody's in the area, I definitely
Please
suggest,
stop by.
yeah, stop by and
Absolutely.
do a tour. Justin, I'm going to make you host so you can share your screen and show us what we basically wanted to talk about.
Sounds good. All right. Oh, let me see here. Stop sharing. So I just realized when I play the presentation, it hops over to the other screen. So okay. All right, you can see that okay?
Absolutely.
Perfect. All right. So once again, we're going to review the Glidewell in-office solution, and I'm going to introduce you to what it's all about, some of the technology, some of the incredible materials and uses of the system to ultimately make your treatment options improve for your patients, improve on your life as well as a dentist. And really, I think it's a fun and satisfying way to go about things. But first, we'll talk about just digital impressions versus conventional impressions. As a lab, Glidewell does receive both, several thousand each week. And a breakdown of conventional versus digital, in case any of you were curious, right now the breakdown is 60% of our impressions come through as conventional impressions and 40% come through as digital. And we receive pretty much every single type of digital scan from the different manufacturers, different scanner options available. And so that's actually a pretty great number to see. It's nice to see the fact that there are more and more dentists embracing digital scanners, and there's many, many benefits to that, starting with the fact that conventional impressions, do our patients really enjoy getting them? You know, it's kind of a necessary evil for us to create the necessary or needed treatments, right? Whether it's a fixed or removable situation. But this study is really interesting. Dental impressions are the third most feared procedure. And coming in at number one is the injection, the needle. And number two is really any form of prepping, any form of drilling on the tooth. But did you know, or did you imagine that dental impressions would come in at number three? And it's no wonder, taking this photo into account. I just pulled it off of Google. Hopefully that patient made it. But since we get impressions of both types, we do have a really good understanding of the remake rates of conventional versus digital impressions. And what we see, number one, is the fact that with digital impressions, we can eliminate a lot of the materials and the steps involved with fabricating a restoration. Many of those steps would be pouring the impression, having to modify the impression to create an accurate digitization or pour up first of that model. Everything gets digitized, as you'll see in a minute. And we do track the cases for both digital and conventional, and we see a great reduction in remakes at the margin. So these are all reduction in remakes for digital scans versus conventional. So 21% reduction due to margin issues, 45% reduction in remakes due to fit issues, 23% reduction in remakes due to occlusal issues. So I think this just really speaks to the accuracy of digital impressions. It really simplifies and makes that process more predictable. We certainly all want to have fewer remakes or no remakes, if at all possible, when it comes to our restorations. So let's just take a look at a case. Many of you have, I'm sure, seen this situation in your practice. PFM, fractured PFM. PFM's been a workhorse in dentistry since the 50s. But we take this situation into account. You're most likely going to remove that old restoration, clean up the preparation, and you may take a digital impression. Many of you, if you've already made that switch, fantastic. Again, 60% are still taking conventional impressions. Hopefully you'll see enough to want to make that transition soon. But regardless of which route you take, I want to give you a little bit of background of what that crown or how that crown is made here at the lab. So if you are taking a conventional impression, it gets poured up, but then it gets immediately digitized. So that's a benchtop scanner that sends that digital model to this CAD process, computer-aided design, where a technician is going to create the right contours, contacts, establish all of those important parameters in form and function of that restoration. Once that design is completed, it gets transferred to the CAM, computer-aided manufacturing, which is essentially the milling process. There's so many cases that come through. There's a universal robotic arm that we utilize in the lab that scans the barcode on the Bruxer block. And you can see the mill is creating and milling out that restoration. It takes about 15 to 20 minutes to mill that out. And then here a technician takes that milled restoration and first finishes off the sprue. It's a little button that extends off of the surface that was holding the restoration in place. Once they finish the sprue down, you can see they're going to categorize and really organize the restorations. Here's a firing tray of 8 slots. You can see they number them. That way they can keep track of whose restoration belongs to who. And then they seed it into an ultrasonic bath for about 3 minutes. The ultrasonic bath is going to remove a lot of that residue from the removal and polishing of the sprue, because we really want to get the surface very, very clean. From that point, there's a lot of moisture from that water bath. So we're going to now dry all of that moisture out of each restoration to about 20 minutes in this drying oven. Because at this stage, zirconia and these Bruxer restorations are extremely porous. It's like a sponge. So what we're going to do is now infuse these colors, these coloring liquids into the restoration. And this is how the lab creates a polychromatic effect in that crown. So it creates a little bit more chroma, and then you saw the blue at the incisal and occlusal to create a little bit more translucent effects. After several hours in the sintering cycle, the zirconia crowns are going to shrink down 23% to the final size of the restoration. And so these restorations get milled in a large chalky state, and there's an enlargement factor that's factored in, and then it shrinks down in that sintering cycle, and it reaches that high strength state that Bruxer is so well known for. You can see the technicians are sandblasting to remove any surface impurities. And then now, especially in the anterior, they're going to go through a contouring process, making sure that those restorations, the shape, the emergence profile, the contacts, of course, are all dialed in. And then once the shape and contours are adjusted, then they're going to go through and apply a surface finish. So this is the final step of the process. It's a surface characterization, a surface staining glaze to enhance the overall appearance of the restoration as needed. So if you are sending anterior cases to the lab, it's a great idea to be able to send photos so that we can not only match the contours of the adjacent teeth, which we also do see in the model, but also the color, which is, of course, very, very important. And if you are taking photos, be sure to take a photo with a shade tab next to the prep. That way we can sort of color correct as needed, because depending on the settings on your camera, the lighting in your office, that could all really throw off that final photo. But that's the process in the lab of making a Bruxer crown, whether it's Bruxer aesthetic, the more aesthetic version for the anterior or aesthetic zone. And then there's Bruxer full strength. It's the strong formulation, the 3Y zirconia for those heavy Bruxers or really any posterior situation. And so then you can go from this situation of that older material of a PFM, and now you have a monolithic material. It's one strong material throughout. This is a Bruxer crown for this number 31. And so the lab has been utilizing CAD/CAM technology for many, many years because of the precision, the accuracy, and certainly the efficiency to create a large number of restorations in a short amount of time. And the lab has really dialed in this process so well. They've streamlined it so well that they can turn around cases in as little as 48 hours, especially if you're sending in a digital impression. You send in a digital impression to the lab, they can turn around that case within 48 hours. And it's because that digital scan gets sent straight into that production process, that production cycle. And it's really incredible that we're really at that stage. As was mentioned earlier, I am a technician, and before, when I was making crowns the conventional way, it would take upwards of 1 to 2 weeks to make it. And so it's amazing now with digital technology, creating the most advanced and strongest material we've ever had in dentistry in as little as 2 days really is pretty mind-blowing. But the lab is always looking to reduce the turnaround time however we can. And Glidewell, never resting on his laurels, have created this system, the Glidewell.io in-office solution. And it's essentially a lot of those same technologies that the lab uses, where you digitize the model and you create a digital design, establishing all those contours, occlusion, functional areas, and then now milling that restoration in your office. And it's using all the same materials that you would get from the lab. And what this allows us to do as a lab is to turn around the case in that same appointment, same day. And that's the beautiful thing about this system. And so you have these 3 key components. Again, it's the digitization, so the data acquisition of the scanner, and we can pair up with really any scanner out there on the market. So we are fully integrated with the Medit scanner, which we now call the Fast Scan, which is available through Glidewell. and also the Align iTero scanner. But any other scanner, the Trios, even the Prime Scan from CEREC, CareStream, really anything out there that's open source can be exported. Those files can be exported and imported into this system because it is an open system. And then so from that scan, you can create the design, which I'll give you a demonstration of, and then mill out the restoration very, very quickly. So we'll go into the details of the materials. There you saw in the video earlier about the Bruxer restoration. The Bruxer now that you see here, this is a high strength formulation of the zirconia. So this is equivalent to what we call Bruxer full strength through the lab. It's a 3 mol yttria zirconia. So that is your highest strength zirconia coming in at 1200 or more megapascal of flexural strength. This is indicated for posterior full coverage restorations. You can use this on premolars, molars, and also implant restorations. As far as delivery of it, whatever you're currently using for cementation, the most commonly used now is a resin modified glass ionomer, or you can adhesively cement these restorations in. The mill time for this restoration takes about 30 to 45 minutes, and it's dependent on the size of the restoration, the depth of the preparation, but within an hour, less than 50 minutes, you can have a final restoration ready to cement. And this is really what sets this system apart from anything else out there, is the fact that you can mill a fully sintered zirconia crown. And so again, what that means is these blocks have already achieved or been through that sintering cycle, that oven cycle that you saw the lab do with those milled restorations. And so out of the mill, you're ready to seat this for your patient.
Justin, I wanted to interrupt you for a second because,
Sure.
as someone who just recently got into milling, and I consider myself a newbie, I didn't know any of these states, So when you say fully sintered, zirconia comes in a soft state. And that's why other systems can mill this in 10 minutes or less, but then they have to put that soft state into an oven and for 20 minutes or so to harden it up and crystallize it, correct?
That is correct. That is correct. So the chair-side systems or in-office mills that do mill zirconia, all other systems require the oven cycle to sinter and cure the material. So it does mill a little bit larger, like you saw the lab do, and it does require that oven step. And it may not seem like a big deal, but yeah, in the middle of a busy practice, you're going to have to stop whatever you're doing or have someone else dedicated to getting the restoration out of the mill, polish it, and then throw it in an oven. So as a lab, we know that dentists and your staff, I'm sure, don't want to be technicians. And so this system from the ground up was designed to make it as simple as possible to deliver that high strength zirconia material.
And that's exactly what I was going to get at. There is no good or bad. I mean, they're all good things. Of bringing same day dentistry into every practice is a good thing. It's just that this one works for me well because if I choose to put glaze on this, I can buy a oven and put the glaze on it. But if I don't really want to do that, I put it into the mill, and 30 to 40 minutes later, it's ready to be cemented, rather than you get the same amount of time, basically 10 minutes plus another 20 to 30 minutes for the soft state. Now someone has to be responsible for changing that, putting the glaze on, doing all that stuff. So
that's right.
Just wanted to mention that I'm not, every system has its pros and cons. I'm comfortable with this system.
Most definitely. Well, I'm glad it's working out for you, and you can speak as through your own personal experience of it being more simple, again, from the mill to the patient. And I think that confuses a lot of people. It's because I think those that understand zirconia or know what the lab does knows about that oven cycle. And oftentimes we've had dentists and researchers from all over the world stop by at the show floor at certain conventions and say, there's no way that this is fully sintered. And sure enough, with this is the block itself has already received that several hours of sintering time to reach that final hardened state of zirconia. So it really is amazing the fact that the mill can mill this out into a perfect fitting restoration.
Right.
So as you did mention, if you wanted to glaze, and this is a question we do receive pretty often, is can I glaze this if I wanted to? You absolutely can. But as far as finishing, the majority, 95+% of the users with this system are doing exactly what you're doing, Bob, and that is to take it out the mill, maybe with a light polish, and you're ready to go. So as far as making adjustments to these restorations, it's the same as you would with a lab-made zirconia or Bruxer crown. I recommend using a fine grit diamond to make adjustments to it. And from that point, you can polish. There is a polishing kit dedicated to Bruxer, or if there's a porcelain or zirconia polishing kit that works better or that you prefer, then you can absolutely use that on this material too. So I'll take you through what this process looks like. So this patient came in with, it was a resin restoration on number 30 that actually popped off. So what we did was we cleaned up the preparation. I dropped the margins a little more equigingival, and soft tissue management is very, very important. No different whether you're taking conventional impression or a digital impression. Soft tissue management, exposing those margins are extremely important. And I know, Bob, you've hit on this several times about that double core technique even. So exposing those margins, super, super critical. So once you take your digital scan, so you're going to scan the prep quadrant, the adjacent teeth, the opposing, and getting that bite, which I'll show you in the software here. And now, so this is the design software. So this is that case number 30. Once you open the case up, the very first step of every design is to set your margin or mark your margin. And the margin, as we know, is the most critical component of every restoration. That's how it's going to adapt to the unprepped areas of the tooth. And so I'm using my mouse here. So you're going to use the mouse to help you zoom in and rotate, and you can shift the model around the screen. I'll try not to move too quickly to reduce any or prevent any motion sickness out there. Now, one of the really nice things about the software is the software developers, this software was developed by Glidewell software developers. It's modeled after the same software that's used within the lab, but they've added even more features to make it simple for in-office use. And so for this first stage of marking the margin, there's a process called Margin AI or function called Margin AI, where it will identify where the preparation is. And if you have a nice sharp finish line and good tissue retraction, it does pre-place the margin for you. And this is exactly what it looked like when I opened the case. And just to show you that I'm not messing around here, on the left-hand side, I'm going to hit the reset margin button. It's going to clear the margin. You can see there's a way to manually mark the margin too. But I'm going to show you in this window, I'm going to hit Margin AI, and the software is going to process what the preparation is and place the margin where it sees that sharp finish line. So you can see that red line just drop right into place. And it's not always 100% perfect. So I can see on this distal buccal area, all we have to do is just shift that around. So as far as making changes or editing the margin, when you hover your mouse pointer over the line, you can left click and just drag that into position. And so now you're going to see your preparations in a whole different way. If you haven't done any CAD CAM or chairside milling before, now you're going to pay a lot closer attention to how you're preparing the tooth and retracting that tissue. And so what I normally do is just work my way around. I can follow the margin here. We're going to look at the lingual. We're going to check the mesial side. If there's any other areas that are, or areas that need an edit, you can shift it like I just showed you, or I'm going to make a little move here. A second way to edit the margin is to double click on the line, and then you can redraw a segment. And once you connect back to the line, it resets it for you. So that's a great way, additional way that you can edit the line as needed. But the better your prep is, the better your tissue retraction, tissue management, the more efficient you can be through this step. So once the margin's set, you can
Justin,
see, sure,
I'm sorry, I'm going to interrupt you. I'm going to show
no
a
problem.
couple of cool things that I use for my margins. And as you said, when your margins are, defined and you can separate the gums, it's pretty easy. The AI does that. But sometimes you need a little help. I wanted you to show, maybe you can click that show only preparation only
Oh yeah,
box.
you got
That's
it.
a really cool thing that takes everything, takes
There you
everything
go.
away so you can zoom in areas and see it better. And then your lab, the support for Glidewell IO is so great. I actually take the arrows off as well, the occlusal and buccal. So now I just have the prep almost like a die, that you can look at. And then if you can put the curvature on,
Oh
uh,
yeah.
these are the
There you
tricks
go.
that some of the support guys have taught me, that
Yep.
it basically, there is a little white area that you can, if you have any questions, that's usually where the margin is, right in between the, right. Yep, exactly. So you can set the margin based on that, the little area, the white area that there is.
Most definitely. Yeah, there's I'm glad you brought that up. There's several additional visual aids, such as the show only prep, making a die. The curvature function, what that does is it highlights edges on the tooth. And you can even turn this or turn the color off. So I like to actually use the color or the stone model that with the curvature function. I find it provides an even nicer contrast on the finish line. So you can use that to maybe better visualize and better position your margin. So that's really neat.
Yeah, and even if you turn the curvature off in this state, and if you rotate it, like look at it from the bottom, you can actually see. No, not the other. I'm sorry. Yeah, this is good too. But like if you get close to it and look at the margin from sideways, you can actually see where the prep is, and
Oh
maybe
yeah,
like in the mesial buccal, maybe a little bit short. So you can adjust it really well.
most definitely.
You know.
Yes. You can spend a lot of time evaluating your margin as needed. And there's several different ways. I turned it, you said upside down or turn it around. I thought, because there's actually some users that kind of enjoy or prefer looking at it like an impression. So you can edit the margin also from that view too.
Yes. Yeah, it becomes fun.
Absolutely. Absolutely. There's a lot of different ways that you can go about using the software. Yeah, there's a lot of different tools, and I really just want to show you the workflow, a simple process, but I'm glad you're showing some of those tools that you learned about to aid with your marking of the margin, because as we know, it's so important. We really want to get that dialed in as best as we can.
Right.
All right. Well, thanks for that. So I'm going to turn off the show only, and we can go and turn the color back on. So it's really up to you if you prefer marking it in color, which is great. If you want to see that contrast between hard and soft tissue, you can toggle the margin on and off on the lower right-hand side here. If I also like to use that in areas that may be a little bit more questionable. And of course, you saw the curvature both in color and stone to help aid with the placement of the margin. Now, those arrows that we spoke about a minute ago, I'm going to turn off curvature. The occlusal and buccal directional arrows, you can see once the margin is marked, the software puts these arrows on, and this is essentially identifying to the system what is north, south, east, and west, what's buccal, occlusal, and this will help feed that information into the design algorithms to create a really accurate design proposal. And so right now, what I normally do is just look straight down on the occlusal plane, And then from there, you can double click on the blue arrow and it just points straight to the occlusal. And that way, for the prep and for this design, it's going to match the occlusal of the adjacent teeth. And so once the margin's set and you mark the or set the occlusal and buccal arrow down on the bottom of the screen, I'm going to hit design. And the software is going to now, from that margin position, analyze the adjacent teeth. It analyzes the opposing dentition to create a proposal, a design proposal that should require very little adjustment, and it's going to match this clinical situation as best as we can. So you can see here's the proposal. And just to give you an idea or layout of the software here, on the left-hand side, we have this column of tools. These tools allow you to make adjustments to the design itself. On the right-hand side of the screen, we have our visual options, visual aids. So you already saw some of those for the model. And if we navigate a little lower, you can see maxillary, mandible. So this is how we activate and bring about our opposing model. And we can look at it both from the lingual and buccal. So you have several different views, several different ways that you can analyze your design. But we can see this is a really nice functional design. You can see how the buccal is fitting right into the central fossa of the opposing, exactly what we want. We can view it from the lingual as needed. You can see where exactly those contact areas are on your design. So you can see a little bit there on that marginal ridge. And so you can dial this in really however you want. I know there's a lot of different philosophies on occlusion. You can make adjustments in whatever area that you want to your heart's content. But I'm going to keep things a little simple here and really just show you what's needed in order to send this off to the mill. And that would be to set your contact parameters. So there's basically 3 zones of contact. You have a contact on the mesial, contact on the distal, and contact with the occlusal or the opposing area for your occlusion. And so you can see that with the values on the design itself. So notice how there's a 0 on the distal, 0 on the mesial, and a negative 350 on the occlusal. So these are our 3 zones of contact. So I'm just going to spin around here. I'm just more used to having the buccal facing down. And so I'm going to just bring the design a little bit over to the left-hand side here next to this window. So you'll see that there's this window that's on automatically. This is our contacts window. And you'll see there's 3 areas of numbers on this window. And so this is where you can set how heavy or how light you want your contacts to be. We, of course, provide recommended values. And these are my recommended values for Bruxer restorations. So I like to have it on 0 and 0 and minus 350 on the occlusal. Now you might be wondering, why is it a minus 350 on the occlusal? Would that be too open? No, we're actually compensating for the machining of this restoration and also taking into account the dynamic movement and compression of the teeth. This is just after several restorations and in testing that we've identified these values allow for minimal, if not no, adjustments once the restoration is milled out. And that is what I know most of you, I'm sure, are hoping for with your restorations, whether it's from the lab or, of course, chairside. Now, one of the neat things, and you can see we preset these values. So there's an area in the settings where you can set what you want those values and contact parameters to be, so that every time you enter design, those numbers are going to be set. So we technically don't have to do anything. But I'm going to show you a little something extra that we do have here. We all may have a different desired broadness to the contact, and the software here has a great function, a great tool to establish that. So on the bottom of the contacts window, you'll see that there's a button here for mesial, edit mesial spot, edit distal spot. So I'm going to go to edit mesial first. What these tools allow you to do is you can see when I click edit mesial, it brings us to a straight on view of the mesial neighbor, number 29. And so this tool, what it does is it allows you to now draw how large and where on the adjacent tooth you want the contact area to be. So you can draw your contact area. You can see, we can visualize where on that tooth surface it should be located. And then once you draw that area. I'm just using my mouse, left clicking and holding and drawing an oval. Once I'm happy with the drawing, I can hit the check mark to accept it. And then now we'll go to the distal and I'm going to X out of it for a second. Look how the distal contact may be a little bit more open. So let's make it a broader contact. So I'm going to go to edit distal spot. And I always like to visualize that mesial surface or that contact surface. That way I'm not drawing it too large or too small. And so let's say we want the contact to be a little bit broader from buccal to lingual. And we can see a nice larger surface area. And now I'll accept it. So nothing happens yet. We have that same contact. So nothing happens until we hit this button called Fix Contact. So once I hit Fix Contacts, take a look at that contact area on the distal. Notice how the software is what it does is it just expands that design surface to adapt to the area that I just drew. And it's going to set the value and the heaviness of that contact to whatever number that we have set within these boxes. And so we can see a nice broader contact on the mesial as well. So this window here, this contacts window, has all kinds of great automated functions to simplify the design. And so that's really all there is to getting the restoration milled out or completed, getting the design completed to send to the mill. So once you're ready, you just hit send to mill on the bottom, and then the software is going to directly send this design file to the milling unit. And again, the block will take about 30 to 40 minutes to mill out. And each block does come with a single-use diamond burr, and each one's about $35.
Yeah, I wanted to, before you move away from this slide, I wanted to let people also know that, you know, there are other functions on this software that you can, like, let's say someone may feel like, oh, this crown is a little bit boxy, I want to round this corner off. There are a lot of little icons on the left-hand side that it's really easy to learn, and it's not that difficult. You'll get it, like a smoothness, moving, adding. Like I talk about those last teeth in the mouth that may move distally. You can adjust the contacts yourself. Within a month, you'll learn all of those. And then on the right-hand side, I see that you have a pre-treatment crown as well,
yep,
right?
That's right. I do have a pre-treatment. So what that pre-treatment is a scan of the preoperative tooth.
Yeah.
And so at all times, go on, Bob?
I was going to say that I've in the last few months, I've started to do the scan with the method every time, because you can actually use the old crown's dimensions to try to get close to what it was, not necessarily exact, but so the patient doesn't say, oh yeah, it feels a little different. So it's a good you know, tool.
Absolutely. So the pre-treatment, you can see it scanned in. Anytime you do scan in the preoperative tooth or even a wax up, you can use that for the design. So you can match a new design to get it close. Like this tooth has pretty worn anatomy, and maybe you want new anatomy, but kind of fit within the dimensions of that previous tooth. You absolutely can do that. Or if you're happy with what was there, just copy it and you can easily mill out that same contour and shape. Where this is really useful would be for survey crowns fitting under an existing partial. You're replacing a crown that fit to an existing partial, and that way you can establish all of those critical areas on that crown, the rest seat, the guide planes, undercuts, buccal or lingual. So that way it makes that much easier to make a crown to that situation. Or if the patient has an existing removable appliance or aligners, that way you can have those appliances fit that situation, fit it much, much better. Yeah. I use this function for my aesthetic cases. So I do all kind of aesthetic makeovers with the system. And so if I have a wax up, I can establish the midline, contours, proportions as needed for the case.
Yeah, and I also want to mention here is that if it sounds a little overwhelming, there is no worry. I see that you actually zeroed out the support phone numbers on top of your software, but the support number is up there. And if you get stuck, I still to this day do it. If I get stuck, I call the support and they help me design it. They help me adjust it. They're very, very helpful. And to be honest, I think the support division of the milling department is the crown jewel of this whole system. They're very good. They're very nice, and I truly appreciate what they do.
Most definitely. The support team is incredible in helping users, dentists, and their staff get through cases. In fact, we encourage you to give them a call. They are available to assist with margin marking, really troubleshooting anything, evaluating your design, helping you through more challenging cases. And they are ultimately there to ensure you're successful and never alone whenever you're working on the system. And it's funny you pointed out the support number. I never really looked up there on my software. I'm using a test version of the software, so the ones that you all would receive does have the actual number up there. I need to talk to them about this. Maybe I need to give them a call sometimes. But on the mouse pad too, you will have the support number listed on the bottom. So there's several different areas or places where you won't lose sight of how to get in touch with someone to help you out.
Great.
I'm glad you pointed out, yeah, there's a lot of different tools. So sometimes the aesthetics, or most times aesthetics, are very subjective, and you may look at this crown and may want to change a cusp position, contour, embrasure position, marginal ridge height or position. And so just to show you some of those tools that Bob was alluding to, on this left-hand side, we have this section called Sculpt. And you can see when I click Sculpt, so I basically went away from this context window, went to Sculpt, and you'll see there's a row of tools here, and on by default is one of my favorite tools called Freeform. And what Freeform allows you to do is really take control of literally any part of this design. And so you'll see there's a bubble when I hover over the design, and I now have full control over it. So I can left click and hold and move that around. And you can also change the size of what you're controlling. So you can control a larger portion, or you can see when I make it smaller, less of the design. And so the software does give you immediate feedback on how any changes are affecting the contact areas. And also, if you go really low, you can also see a thin area begin to form. So it does have some warnings within the design to notify you of any critical changes that can affect the outcome of your case.
And also there is a back button on the upper left corner. So just in case you mess up, you can press the back button and it goes back. Another
really good one. So let's say you start, you get a little out of control, and you're playing around, and what happens a lot is, as you're learning the mouse movements, you might accidentally pull something way off. As Bob said, you have the undo, which all great softwares have, to just get you right back to a safe spot.
Right.
What other favorite tools do you have, Bob, besides
the only thing I wanted to mention is that if you don't like what the AI gives you, and sometimes the AI has a hard time suggesting something, there is a great library as well that you then become, I suggest that to people, to once they get used to the software, then they can actually create a quote unquote perfect looking crown with the way they want it by using a library tooth in that area. Everyone has their favorites, but I like the smooth. The smooth button for me is, I can even reduce with it a little bit, if I wanted to, rather
Absolutely.
than using the move button. But yeah, it's a great software. It's staying in the office after hours playing with it definitely will enhance your experience later on.
You can see I'm using that smooth function to just even soften the anatomy and wipe that away. And let's say you smoothed a little too much. Now your contacts are a little light. Now you can just hit fix contacts to just bring that back into a better position. So there's a lot of different things that you can do. It's almost like Photoshop, dental Photoshop. You can make all kind of adjustments. We would really spend all day diving into everything that the software has available to you. But ultimately, I just wanted to show you getting the contacts dialed in, marking margins, of course, and getting your contacts set. That's really what's key to be able to send this off to the mill and have this fabricated.
Right. And if you have your contacts, not contacts, your margins defined, your assistant can literally mark this after a week of looking at it. My assistant is now she literally fights me over, I want to do it, because it's it's a fun thing in the middle of the day.
Absolutely. And that's what we often hear from a lot of users. Once you kind of learn the system, get over that initial learning curve, it does make dentistry and make the treatments that we do, the bread and butter stuff, at least the bread and butter indirect restorations, a lot more enjoyable. And that's what it should be about. It's definitely very rewarding.
Great.
All right. Yeah, I'll go into another case after I'm going to switch back over here. Okay, so this was the number 30. There was a prep, and that was the design. So again, this is Bruxer now, the 3Y high strength zirconia, and with just a light polish on the restoration. And I normally use a resin modified glass ionomer, such as 3M's Reliax Luting Plus, but whatever cement that you like using, you can use an adhesive resin, self-adhesive resin. It's really your personal preference. And we do have guidelines on bonding these restorations as well. And by the way, Bob, I didn't see what time we started. So just
we still have a half an hour.
Okay. All right. Just feel free to holler if you need me to wrap up. So this next case, this is another one I want to take you through. This is number 19. So lower left first molar. You can see there's a big patch of some restorative material there. Let's take a look from the buccal. You can see a class 5 composite along the cervical area. And we're going to prep this down. And so I think with that class 5 composite, there was a bit of bone loss. So I barreled out the furcation and created my finish line along that furcal area. And we get this scanned in. So I'm going to dive back into the design software here. So I'm going to open this next case, and let's see what this design process is. So Bob, if you come up with more interesting tools that you love using, feel free to holler and we can talk about it. So once this case is open, you can see our preparation. And once again, the margin AI does take effect, but there's some areas, this is a little bit of a different type of preparation than the systems have been written for. So you can see along this furcation, it didn't mark through the furcation. So all I have to do is I'll double click on the good area, the margin, and just kind of like connecting the dots. I'm going to give some clicks along here and just draw a new segment. As you saw earlier, we had that curvature function. You can use that to aid yourself or turn it to stone, which I like to do. And Bob likes to show only preparation, which is always nice. Isolates the prep on its own, gives you more visibility in those interproximal areas. And I just follow around the margin or follow around the preparation and see what areas may need to be modified. So I'm going to go to the lingual side here and center on the lingual. I can see that it's really fallen over the edge. So I can just shift that margin a bit upwards. And
while you're doing this,
side. Yep.
While you're doing this, I wanted to stress that we actually use in this step, we use all the options. I use curvature, I use preparation only, but when you take the preparation only check bar box off, you actually can, when you see the whole prep, it shows you the tissue a little bit even better. So now you can readjust. So we use all of them at the same time and make sure they check out in every little step that there is. It helps to use them all at the same time and then one at a time.
Absolutely. There's a lot of different tools, as was mentioned. So you fire all of them on, huh? Show only prep, you turn on the curvature,
Exactly.
and
Because each one shows you, like if I'm having an issue with one area of my margin, I'll check them in every little color and I'll definitely get it perfected in one of them.
most definitely. And you do, of course, get more efficient as you do more and more cases. We find usually 5 to 10. Many users get much more comfortable with this process. But hopefully I'm showing it fairly easily here. You can see it's really just a matter of the software does pre-place most of it for you, and you have these couple of functions to make edits to it, just clicking and dragging, or as you saw earlier, you can double click and draw a new line. Or like in the design process, if you make some accidental changes or changes that you wanted to reverse, you can undo very, very easily. So once again, once the margin's set, I'll turn off curvature now, and you can set the occlusal. The buckle arrow is usually right on, and now we're going to hit the design button right on the bottom. And so once again, you're seeing in real time the software assess, analyze the adjacent teeth, analyze the opposing, and give us a nice starting point for our initial design proposal. And so on the right-hand side, again, if you want to check how the opposing teeth interact with your design, you can easily hit the maxillary or mandibular, whichever side is the opposing, and you can check it from both the buccal and lingual. And you can see the AI does a really nice job of making this starting point for our design. And once again, how do you know that you're ready to send this off to the mill? It's really just making sure that those contact values are what works for you. And this is what works for me. The 0 and 0 on the mesial and distal, and minus 350 on the occlusal. And this time the software did create a nice broader contact on both the mesial and distal. But of course, if you want to make even further changes, you absolutely can using one of those tools. And so once again, just to show you the free form, let's say you wanted to maybe change the contour. That's the freeform tool, expanding or contracting the surface as you'd like. Anything else you want to change here, Bob?
No, that looks pretty good.
So not a bad design, just all from the software. But as you see, if you wanted to change it, you can. If you're happy with what the software provides for you, just verify that those contact values are what you want, and then just hit send to mill, and you're ready to go. All right, let's take a look at what this final restoration looks like. And that's where the prep was. You can see the milled restoration. The mill follows that vertical area. And we seat this down. So this final photo was taken about 2 weeks after the delivery, and you can see how the soft tissue filled in that furcation area. And we know that soft tissue really adapts well to zirconia, and even more so to just polished zirconia. So there's nothing on the outer surface. There's no stains, there's no glaze, there's no roughness of any kind from that characterization process that can sometimes happen even from the lab. So you have a really smooth, polished surface, which we know zirconia is highly biocompatible. Let's take a look at the occlusal. And this is just with a light polish. I mentioned there is a Bruxer polishing kit that you can use. And there's really just that one polisher that I like using from that kit. There's a brown and blue polishing wheel. That brown polishing wheel does a nice job of getting a nice light polish on there. Let's take a look at one more. And if your eyes are going to number 18, I'll show you what I did on number 18 a little bit later. That is a composite with some recurrent decay. This case here, back to number 30, lots of restorations on 19 and 30s. This number 30 had this was an Emax restoration. Didn't fit that great, a little open margin, some chipping on the lingual margin. I don't have an image of that, but here, endo treated, you can see down in the access area, I cleaned out the old buildup, and there was a kind of a lot of excess gutta percha that I removed from here. And with these endo cases, you can actually mill what we call an endo crown, which is basically some of the buildup with the crown. But since I'm planning to have a Bruxer crown milled out for this endo case, I'm kind of thinking ahead in the event of a re-access or a need for a retreatment for whatever reason. Do I really want that thick of an area of zirconia all the way down to the access area? So I did a little bit of a hybrid. So I did a slight buildup. I just put some composite buildup material down at the base just to smooth out the access area. And from this, I just went ahead and scanned that in. So part of this crown contained the buildup. So this is what that design looked like from the occlusal, and just to show you how accurately the mill creates that restoration. Once again, a Bruxer now with very minimal polish on here. I just have to take off the sprue. In case you're wondering about the sprue, the little button or extension off the surface, just using a fine grit diamond works very well to take that away. And we've got a radiograph for good measure. So you can see the old restoration on the left-hand side, all ceramic on 30, and then a nice fit with our Bruxer now.
Excellent.
All right, another Bruxer now material. Now you can see this is a bigger block for bridges. So this is a 33 millimeter by 14 millimeter dimension block. And so this allows you to create, using this same full strength formulation of the Bruxer, you can do both anterior and posterior bridges, 3 or 4 units. And so you can see we're at that 3 unit for that image on the left. You can see we can safely fit 1 more unit into that block. As far as delivery, you can use the same approach, conventional or adhesive cementation, and these take about 90 to 120 minutes to mill out, and all using a single burr. It really is pretty incredible. So I'll show you this case here. You can see this PFM bridge the patient had from 18 to 20. This PFM bridge has seen better days. Let's take a look at from the buckle. You can see a little bit of recession around the margins. And so we take this off and I get the preparations cleaned up. This was one of the most challenging cases I've ever had to prep. Patient was a gagger, could not open much at all. But fortunately, we were able to get this case milled out, get the preparation done and designed. And I actually want to take you through what this design process looks like for a bridge. You might think it's really, really challenging, more difficult than a single unit. There's obviously more to consider. You've got double the margins. You've got connector areas between the abutments and the ponic. And so this is the case here. So the margin AI does start out by establishing the margins or pre-placing the margins. And here I actually didn't do a great job of retraction, but you can see using the color mode, and since I prepped it, I have a pretty good idea of where to position that margin line. So I'm going to move this in a little bit on number 20. So if you see on the bottom of the screen, I had set this case up as number 19 to 21. And it's kind of one of the tricks in the software. If I set it as the true number, 18, 19 as the ponic, and 20, what it would do is the software would squeeze in, since the restorative space for the ponic is relatively small, it would be a really small molar, since this, again, if you set it up as number 19. So what I do is I change it from 19, have the ponic be number 20, so that way I can have premolar anatomy right into that space for the ponic. And so just one of the kind of tips as far as setting the case up. So here on the, yeah,
I'm going to interrupt you. So
Sure.
basically, because number 18 had moved forward, you call this 19, 20, 21 to for the AI to actually create a premolar instead of a molar because you don't have a space for molar. Is that what you were saying?
Exactly, exactly. Now, there's nothing wrong with setting it up as 18, 19, 20, and the AI would create a molar. It would put molar anatomy. It would just be really narrow, really small, dimensionally mesial distal. So not a huge deal, not something that our patient would really notice, but just looking at that restorative space, I thought premolar anatomy would work out a little bit better. So let's take a look at what it will do. We're going to hit design, and the software is going to do its thing and create our design proposal. So we can see if there's a violation of any material thickness, it'll let you know. We're going to hit OK. But usually if there is a thin spot, the software prioritizes creating enough material thickness for each restoration. So that shouldn't be an issue. And if there is, you can always add to the surface as needed. So here is our proposal. You can see with bridges, certainly more likely to have undercuts if that is the case. And we can always verify it. I'll show you afterwards how we can check that. But with our bridge design, you can see we have 3 individual designs. I just click on each one and notice how the software got the occlusion right where I like it, -350. Here is a little bit heavier. But what I see is maybe it's actually on the mesial side, it's hugging that mesial tooth a little bit more. So what we can do is, Bob mentioned the smooth function. I'm going to hide the mandibular model. So I'm going to get rid of the prep model. And you can see how there's a little bit of an extension on the buccal, that mesial buccal area. So all I have to do is I'm going to go and find that smooth tool and just smooth out that little extension. And what that does is just make a nicer contour on that mesial surface. So just a minimal change. Now we're no longer really hugging that mesial neighbor. And if for any reason, like I'm smoothing this contact area here, let's say you wanted this contact area to be a little bit heavier. Let's just see where our opposing model is. So I can see we essentially want to have contact on that cusp tip on mandibular posterior teeth. So let's just bring that up and just get it into a better position. So there are little things that you can do. So here it's already within contact. Here on the molar, we're pretty much there as well. But there's little things that you can do to modify the design if you can make a little improvement or you see an improvement that can be made to the functional areas or, of course, the aesthetic areas as well. So it's pointing out there's a couple of undercuts on the design. So on the left-hand side here, the 3rd button down, and you'll see when I hover over any of these icons, it does pop up with the label of what that tool is. So you can see this ruler is measure. The 1 second from the top is contact. And 3 down, this is margin. So let's go to margin. And inside of the margin section, there's this section, or next to margin, there's a button called milling and insertion direction. And this is where it points out where those undercuts are. And undercuts are not a huge problem as long as they're not really on the margin. So you can see it highlights the undercut based on the path of insertion. With a bridge, you want both abutment teeth to have the same path of insertion. You'll see that when I move this arrow here, they're linked together. And so you have the option maybe to move this arrow to see if you can eliminate the undercut. And so just moving that slightly to the buccal did actually cut down on those undercut labels. And you can see there's still a little bit of red, but I usually, as long as I don't see an undercut at the margin from this one bird's eye view, the insertion direction, as long as I can visualize both margins, I'm ready to go. All right, so I'm going to close out of the insertion direction. And that's our bridge design. What do you think, Bob?
Pretty easy.
Pretty straightforward, right? There's really not a whole lot of designing going on. And you can see the software, when I click on, let's say the ponnet, you can see how there's numbers here for how heavy the contact is or the connector area is. This number 43 BC, the BC stands for bridge contact, and it's actually a calculation of the height of that connector by the buccal to lingual width. So it's height of the connector squared by the buccal to lingual width. Essentially, what we're shooting for is a connector size of 3 by 3 millimeters. If it's a little shorter than 3, from gingival to occlusal, that's usually a violation of what we would want. But the software calculates all of that for you. So if it was in violation, just to show you if we were in violation, I'm going to move this surface in. Notice how it turns that area red. So it's really intuitive. It gives you real clear visuals on when it's safe, when you have a good contact, when it's violating, whether it's thickness or too small of a connector.
Justin, one of the things that I don't do many bridges these days, but one of the things that I used to do with bridges was try to make them hygienic. And that was an easy task with PFM. With zirconia, I hear that these pontics need to rest on the tissue for support. Is that what Glidewell also recommends? Can we make this into a hygienic pontic so people can clean it better?
I'm glad you asked that. You absolutely can. So as far as pontic design, you have the freedom to make this. What the software typically will default to is a modified ridge lap or slight ridge lap. So that's kind of what we have going on here. But if you want it hygienic, notice how when I click on the tooth itself, this is an introduction to another tool. This is move, rotate, scale here on the left with the arrows. Notice how there's arrows around the design. And so now at this gingival region, I can just expand this upwards and you can lift the whole gingival portion above the tissue. And if you wanted to really just flatten it out, you can design it however you want. So let's just say we hide the model. And if you wanted to maybe shape the center of the pontic, you certainly can, or raise just the buccal a little bit more. You have absolute freedom to do that as well. With this high strength formulation of Bruxer, the Bruxer now, the 3Y zirconia, you don't really need to have that gingival support.
So it won't break.
No, this is very strong. And so one of the things that we do to avoid and ensure that high toughness at the connector area is this connector calculation. So as long as we hit the 27, it's the product of that formula I mentioned, the height of the connector by the buccal to lingual width. As long as we're in that green zone, there's plenty of thickness, mainly from cervical to occlusal. Zirconia is much stronger, and probably most materials, but zirconia especially, it's much stronger when you can have a taller connector along those areas.
Yeah, so if it's in the posterior, you can just make it even a little bit bigger than that 27.
For sure.
And leave it off the gum so the patient can clean it properly. Excellent.
Absolutely. So I know you don't do a lot of bridges, and I don't either. We're in that world of implants, but if a patient has a pre-existing bridge like this case here and opted against an implant, bridge options or the bridge option is here available with the system. So definitely a cool option.
Justin, I hate to cut you short, but we have 10 minutes.
All right.
So if you wanted to wrap up, that would be great.
Not a problem. Okay, let's see what okay, let me go back to the presentation. So you saw the design. And so for this case, so that little trick I mentioned about setting it as a premolar, that came after the fact. So this is what it does look like with a molar anatomy squeezed into that pontic site. Us as dentists and technicians, we may notice it, but for most patients, probably not. You can see that little buccal groove, a little bitty buccal groove there on the pontic. I'm going to quickly go through some of the other materials. So this is Bruxer Aesthetic. So this is our 5Y, 5-mole yttria zirconia option. So what this is it's a little bit lower in flexural strength, but the trade-off is increased translucency. So the more yttria content, the more translucency, a little less flexural strength, but the Glidewell material scientists have been able to get up to 900 megapascal, which is still pretty incredible. This can be used for premolars forward, so the aesthetic zone, and it's a little bit of a smaller diameter block. So it really does accommodate anterior restorations and premolars very well. Conventional adhesive cementation and 25 to 45 minutes of mill time, all depending on the size. I'm going to quickly go through this case here. This is 8 and 9 PFM. Patient needed endo retreat. So before we send the patient off to the endodontist, I don't like doing endo. So we first clean up the preparations and we mill out a couple of biotemps. So these are provisional materials or provisionals that you can make chairside. You might be thinking, why would I want to make provisionals? But there could be several situations like this case here where you want to just have something fresh on the preparation, have the patient try it out, or for any aesthetic case, I do love using this process. Evaluate the aesthetics, have the patient test drive the aesthetics, especially if I'm doing like crown lengthening, allow the soft tissue to heal. You basically get a perfect fitting provisional in this PMMA material that mills out in 5 to 10 minutes, real easy for your patients. And so you can see it's shade A2. We see these down, already improvement from the PFMs. Patient goes off to the endodontist. We inform them that it's a provisional, makes their lives easier too to do the retreat. And then when they come back, we take that off, take those provisionals off, and I do a couple new buildups, new posts and buildups, drop the margins measly a little bit to get somewhat of a papilla out of this case. And these are our Bruxer aesthetic now restorations milled out. Again, these were about 35 minutes of mill time for each of these, and just with the polish. So once again, it's a fully sintered material, no need for an oven. And so this is a comparison to before and after. This case here, this is a full mouth case that I did with the system. So that's Bruxer aesthetic now from premolar to premolar, and Bruxer now the full strength version on the molars. And this is with just a polish. I did do some crown lengthening in the anterior, but this is really just to show you the capability of what this system can accomplish. So this is the occlusal designs, and you can see those numbers there on number 3. The designs are set to the same occlusal parameters, proximal contact parameters that I would use on a single unit case. And the software, as Bob mentioned, the library teeth, I just dropped the library teeth down and set the contacts and set the overall aesthetic position or functional positions where I want them. And so here's a good look at the before and after on the maxillary, and a look at the lower. And so once again, just polish, straight from the mill, polish. No oven was used in the making of these crowns. And so here, just to finish with the patient, always nice to see the transformation. And so this is fully sintered restorations from the system, full mouth rehab. All right, maybe in the future we can dive into that in more detail.
Sure.
So the next material, this is camouflage. This is also a fantastic material. This is essentially a composite material. Composites are really just hybrids of materials. So the composition, percentage composition, is 80% ceramic fillers and 20% resin. So it's mostly ceramic. So you can build this out as a porcelain or ceramic restoration as far as your reimbursement goes. As far as the flexural strength, 200 megapascal. It may seem low now in comparison to what we just reviewed with the zirconia, but the key to this is adhesive cementation. You're going to air abrade the material, and then you're going to apply a bonding agent or adhesive to the internal, and really any resin of your choice. Sometimes heated composite, some prefer that, or again, any resin cement. Let me show you this case here. Patient came in with cavitation on the mesial, pretty large, but I like to try to still be conservative. I like conservative dentistry, preservation of healthy tooth structure. And so once I remove the pathology, I extend along the DEJ buccal lingual and just making sure things are open. So following the same principles, rounded internal line angle, sharp finish line, still packing core, that's a size 2. And then here in the software, you can see the design, and the software easily handles it. You saw it do bridges, you saw it do full coverage, and partial coverage, no different. It just puts out a little puzzle piece of whatever's missing, and from that point, you can mill it out. And so this is a future update to the software or to the system where it's going to thin out the sprue even more for non-Bruxer materials. And all I have to do is just finish off that little connection, and then polish it and bond it in. And so this is what the restoration looks like. We call it camouflage. It comes in two different translucencies, high and low. I normally use the low. I find it has a little bit more warmth and color to it. And just to show you what that before and after radiograph looks like, you can see the decay there on the left. So great fitting option, real easy, takes about 5 to 10 minutes to mill out, and we do bond that in for a great result. Let me show you another one here. This is a cracked tooth syndrome patient. No pressure sensitivity. Take off the old amalgam. You can see that fracture mesial to distal. For these cases, as long as the tooth is still relatively stable, of course, it's not moving in multiple pieces. I'm going to do a full coverage. And so I do a full coverage, kind of like an overlay, crown lay. You know, we hear different terms. I like just overlay. But to the software, we just call it a crown. And so you can see I dropped the boxes a little bit mesial distally just to try to have a little bit more support through those areas. And well, this is camouflage. So I know I can get an extremely high bond strength to this material, AirBraid and adhesive protocol. And we AirBraid with 15 micron aluminum oxide to roughen the intaglio. And then we bond this on. And so within a week, the patient says all of their pressure sensitivity went away. So that's a really great result, great outcome. You can see I'm keeping that buccal margin, kind of similar appearance on the lingual as well. A great restorative outcome, and trying to be conservative for this type of situation. And so you can see a great fit, great margins for this case.
Right. And you guys have a silicate material as well, right?
That we do. Let me get there. So I'll quickly just burn through this. And so the final material, so you saw Bruxer, you saw the composite material and camouflage, and now we have our obsidian block. So obsidian is our lithium silicate. This is the only material out of everything that you've seen that does need an oven. So what the oven does, you can see the life cycle of the image on the left. The oven is going to crystallize the material. So because of it being a glass ceramic, it is more prone to chipping. And so to cut down and reduce the risk of chipping, it mills in a partially crystallized state. So the block is a little bit purple in color to remind you that there's something else that needs to be done to it. And so in the oven cycle of about 25 minutes, it's going to crystallize. So there's crystals within it that enlarge and will reach a hardened state of 400 megapascal flexural strength. This is also very versatile material, can be used on anterior, posterior, partial, or full coverage. I've used this for veneers. I've used this for full crowns. I kind of use this mainly in the aesthetic zone because I've kind of transitioned to either camouflage or Bruxer in all my posterior areas. But still takes not that long to mill, 10 to 20 minutes. But if you do want to use it, you do need to put this in the oven. I do want to mention, though, what's coming down the line is what we'll call Obsidian Now. So this is going to be available sometime spring to middle of next year, where a new formulation of this is going to be available. It's actually going to be a lithium disilicate, and the material scientists are going to make it in such a way that once it mills out, it's ready to deliver. And I actually have a card here. I know you can't really see it, but it's samples of this Obsidian Now. And I tell you, this will be a beautiful, beautiful block. And the goal is kind of fitting into the family of Now materials where you can mill it now, but the Now actually stands for no oven wait. So out of the mill, straight to the patient, with the option of putting in the oven if you wanted to. So just an example of utilizing this material. This patient, apologize for the blurriness of the picture. Patient sent this photo to us. It was actually, this case was done by a dentist in Chicago, near you, Bob. And the number 10 popped off, and he's now living in California. So dentist reached out to us, and he came to us for a solution. So we made him, he had Emax veneers on his anteriors and upper and lower, and that number 10 we just did an obsidian and did some surface characterization. Here's a closer look at it. Looking at it after the fact, there's some contouring changes that I would make, but overall, patient was extremely thrilled. Just one more veneer case for you. This patient had veneers 7 through 10 and didn't like the size and shape. I told her, yeah, the proportions are a little bit off. So what we did for her was we did 6 through 11. So I did minimal prep veneers on 6 and 11 and just reshape, recontoured the preps, cleaned up the preps on 7 through 10. And so you can see the before of our patient Sam here. And just, it's amazing once you get a nice, nice proportions, good size, and still using the system. So you can see no limitations from anterior to posterior, utilizing what we have available, just like what you would get from the lab. I know we went through it a little quickly, but if you have any questions regarding anything that I reviewed today, feel free to reach out. I'll be happy to answer your questions.
And Justin is part of our group also, so if you want to post a case and tag him, he always answers. Thank you very much, Justin. I really appreciate it. So we can maybe do this a little bit later with, you know, a little bit more detailed for single procedure, like let's say design or Bruxer now. But other than that, thank you very much for joining me, and hopefully we can do this again.
Absolutely. Thanks again for having me.
Great. Thanks, Justin.